So let's talk today about the Healthy People 2020. This is a vision for our society at the federal level that looks at some of our lofty goals to improve the health of all of our citizens. You've had a chance to review these, and so we're going to now talk about how do we implement that and how do we get this into an action plan. One of the first things I think that we have to do from translating these goals into a workable plan is to look at some of the social determinants of health. When we talk about these, we're looking at a number of factors such as the economic stability of a person, their education, their overall community and the context of their community, what their neighborhood is like in terms of safety, in terms of access to transportation, and all of those things are factors in helping them access health care. So if you think about it for a second, if a person doesn't have access to public transportation, or it's incredibly difficult to access, then how would they make it to their doctor's appointments? How would they do follow-up care? And how would they get prescriptions? Also, the economic stability. Would they have the resources at the very time that they were sick? So we're going to look at some cases in a few minutes in which we look at social determinants of health with particular people and how those have a direct relationship into their health care. We've talked in the past, but we're going to talk more today about social justice. Justice includes the wealth within a neighborhood, the wealth within a family, and ultimately to an individual. There are opportunities that the wealth brings, or the lack thereof, and some of the privileges that come with that. You'll have an opportunity in a few minutes to think with a specific case how those factors are relevant to the health care of an individual family. Finally, the last thing before we go to our cases is we want to talk about what the American Nurses Association has to say about social justice, and that we as nurses actually have a responsibility to promote social justice. So think about that in what you've done in your volunteer work so far, and what you might do as a professional to promote social justice. So it actually, from the ANA standpoint, it's not an option, but it's actually our duty and part of our code to respect the worth and the dignity of everyone, and part of that is to promote their social justice.